Well, turning to the pandemic and the toll it's taking on healthcare workers, I'm joined now by Dr. Martha A. Dawson, and she is a registered nurse and the president of the National Black Nurses Association. So, Nurse Dawson, just thank you so much for being here with us on this New Year's Eve.
Thank you. I'm delighted to join you.
So this pandemic has been brutal, with more than 762,000 people losing their lives because of COVID-19 so far. So what are you hearing from your colleagues who are caring for so many of those people around the clock, and how are they holding up?
You know, this has been a longer pandemic than we anticipated. So the nursing staff are getting a little tired at this time. But many of our nurses are still working on the front line every day, providing excellent patient care. And we need for everyone in the public to join us and to work with us and not against us, and trying to overcome and at least fight this virus. It's going to take all of us working together, not just the nurses and the healthcare workers, but the general public as well.
Yeah, everyone working together and just staying educated. And as we mentioned earlier, so many nurses and other healthcare professionals are leaving their jobs. What are some of the main reasons why they're getting out of the field? Some say they thought that they would never leave.
I think you have three things that are playing here. First of all, you have those individuals that was planning to retire anyway, and they're at retirement age. And so they're saying this is the time for them to get out. Then you have other nurses, meaning that they're going in working not only 12-hour shifts, but many times they're staying there over, 12 hours. So they may be putting in 16 or 18 hours. And then they are short of nurses at this time. But we have to understand that the nursing shortage that we are experiencing is also due to increased demand in nurses, as well as we had a shortage of nurses. So it is very difficult to have to work understaffed, every shift that you're reporting in. And also at the same time, you need to try to protect yourself. This is taking a spiritual, a mental, as well as a psychological toll on the nurses.
And again, being a nurse, even before the pandemic, was so rough, and you talked about that physical, psychological. Some hospitals are requiring their staff to get vaccinated, and that has been a sore spot this year, and for some nurses across the country, with some even refusing to get vaccinated. As for the nurses, the National Black Nurses Association represents. What can you tell us about where things stand on this issue?
Well, we have to remember that the nursing population is just a small portion of our larger population. So we're going to have nurses that have the same different thought processes and conceptual ideas around vaccination as you're going to experience in the larger population. So what I want people to do is to step back and realize that there are certain policies, procedures, and things that must be put in place, not just by the federal government, but by every organization where nurses are working in different institutions. So, for example, when they started saying and made the decision that they were going to reduce the number of days that a person need to remain quarantined in if they was tested positive, that is great, but you also have to have an organization that is going to support and respect those nurses, that if they call in and say, yes, I know it's beyond 5 days, but I'm still feeling bad. They need to do that both for themselves as well as for their patients and their colleagues, because we don't want them back into the setting too early and begin to spread this virus even more. For those nurses who are saying, I don't want to be vaccinated, then you got the same laws, the same expectations that you have for the general population. However, the difference is going to be this. That nurse that decides I'm not going to be vaccinated cannot turn to her colleague and then say, you need to take care of the COVID patients because I have not been vaccinated. That is that person's personal decision not to be vaccinated, but then they cannot expect special treatment when it's time to take care of the patients that may come into the hospital with this particular virus. So everyone have to do their fair share. If I decide not to be vaccinated, I can't use that as an excuse for not coming in and taking care of patients that need the care. And expect from my other colleagues who have been vaccinated to bear the extra burden of taking care of all of those patients because I made a decision not to be vaccinated.
Yeah, everyone has to do their part. And we showed her a little bit earlier on the screen, but a black nurse from New York, Sandra Lindsay, is widely considered to be the first person here in the United States to get vaccinated more than a year ago. And she reportedly is still pushing for people to get vaccinated. Do you think that more vaccinations is what it's going to take to even end this pandemic? Or what else do you think could help?
We're really in that place where if we don't get more people vaccinated, again, it's almost like what I just described with the nurses. It is like the rest of the general population who are refusing to get vaccinated or asking us, those that have been vaccinated, those who have gotten their booster, to take the blunt of trying to manage this pandemic and the virus. And one of the things I want to point out to people is that COVID-19 and all of the different variants that we're dealing with is not an acute care issue. It is a public health issue. And because we are underfunding public health in the United States and around the globe, and because we have not had that many nurses within the public health space to start with, because the pay is not equal to that within acute care settings, we're dealing with, if we can't manage this outside in the public space, getting people to wear their masks, to wash their hands, to get vaccinated, to get tested, to quarantine in when they need to, then it becomes an acute care issue. Once that patient is sick and ill, then they come to the emergency room, they present themselves at the hospital, they are admitted. And so, but if we can stop and control this virus before it gets to the hospital door, we could better manage the workforce demand and need that we have at this time. So I know everyone's saying there's a nursing shortage. I want to clarify. Yes, we did have a shortage prior to the pandemic, but what we're dealing with is not just a shortage, but an increase in demand for nurses, physicians, also our paraprofessional staff, such as environmental service, food and nutrition, pharmacy staff, respiratory, physical therapy. With this increased demand, there's no way, because of the number of years it takes to educate someone, for those individuals to be ready and say, okay, if Nurse Martha retired today, I have another nurse waiting in the ring to replace her. It just doesn't work that way. And what we're seeing now is nurse migration from state to state, depending on where the hotspots are and depending on who's paying the most at this time. And we know when we talk about who can pay the most, it's going to be those academic medical centers, those large systems with multiple hospitals, and your rural hospitals and your inner city hospitals that primarily serve the underserved are going to be left out on the fringes in terms of trying to match those salaries that we now see out there for healthcare workers.
Yeah, that is a lot to take in and a lot of good information, just clarifying those things that people were thinking, okay, well, there's this shortage, and I'm so glad that you clarified that. And I'm so happy that you joined us here on BNC Live, Dr. Martha A. Dawson, president of the National Black Nurses Association. Again, thank you so much for your insight and your perspective. And again, happy New Year to you.